Welcome to the My Inner Tiger podcast. I'm your host, Sydney D. Camella. I'm also a wife, mother, master life coach, course creator, and spiritual Sherpa. Over the past few years, I have overcome extreme anxiety, depression, addiction, infertility, and chronic illness. And as a result, I've made it my life's mission to teach other women like you that no matter what battle you're up against, you have an inner tiger, a power within to create and manifest whatever your heart desires. If you are tired of being a victim and ready to be boss of your life, you have come to the right place. Each episode, I'm going to share tools, teachings, and techniques I have used and taught countless other women so that together we can create a life beyond our wildest dreams. I know beyond a shadow of a doubt that your inner tiger is just waiting to be unleashed. I'm so happy you've tuned in. Let's get started. Hello, beautiful souls, and welcome back to the My Inner Tiger podcast. Today's episode is amazing. I am interviewing a special guest, England Miano. And without giving it all away, in this episode, we talk about England being a holistic general practitioner, all of the different things that she does and is certified and trained in. We talk about her healing herself from cancer. We talk about why holistic approach in most cases is much better than a traditional Western medicine allopathic approach to healing. We cover why mindset is so important in your healing journey. And we also, at the end, touch on her story about her son's vaccine injury and how all the doctors said he was autistic, diagnosed with autism, among other things, and how he would always need full-time care, and subsequently how he is now very functioning and you would barely even notice that he was autistic. So it's just so many good, juicy stories, so many good hot topics for today especially, and I am so excited to share this with you, so enjoy. I am so excited about today's guest. Her name is England Miano, and I met England earlier this year on my normal search for different ways to heal my body. Of course, I came across her name in a mom's group, like it's called the Crunchy Moms of Tampa Bay group that I'm in. Someone had referred her for something. I can't remember what it was, but they're like, you need to talk to this woman. She does everything. So I just had this strong intuitive hit that I needed to reach out to this woman. And I immediately did it right then and there. And she just happened to answer the phone directly when I called her. And we ended up talking for hours, and she told me, she's like, I never have this much time to talk. You caught me at like the perfect time. So I just thought it was such like destiny that we were having this conversation. And since then, she has helped me through so much already. She's got me doing all kinds of new different things for my body, which we'll get into a lot about that later. But England is a general holistic practitioner. And so what does that mean? It covers a big, broad spectrum of things, and I'm going to let her go into that, but she works with people of all ages, and she practices and is certified in up to 30 different modalities. Like, she is a wealth of knowledge. And so we could sit here and have a conversation together for hours and hours and hours, just talking about the different things that she knows as far as healing your body and doing it naturally. But I really specifically wanted to bring her on today because she healed her own body from breast cancer. And she's seen so many other people heal their body naturally as well. And I know she's helped a good jillion amount of people. So she's just an incredible human being. And I'm so honored to have her on the show. So England, thank you so much for being here.
Thank you, Sydney. I appreciate you. And likewise, as far as your feelings as well. And I just honored to be on and speak with you today.
Yay. All right. This is going to be a really good conversation. So All right, why don't you just start at the beginning and tell us a little bit about your background and how you ended up becoming a holistic practitioner?
Sure. So naturally, from a very early age, I was very attracted to the health field. I think just with my personal interests of always being into athletics and was a competitive gymnast for much of my life and just into all kinds of sports, and really always found myself very just organically tied to wanting to know more about nutrition and almost really kind of the word that they refer to as biohacking today. In a way, it was just always a challenge, even as a young teenager, for me to, set personal goals with myself and from a physical standpoint, also spiritually and psychologically. And um, I do think because of the nature of the way that I was raised and it being, very embedded in my background as far as uh, growing your own food, gardening, cooking, whole food based meals on a regular basis, sitting out down and eating, dinner together as a family. I think that really had a lot to play in to the natural, I guess, interest for me. However, I wasn't for me at that time, because I wasn't holistically trained and didn't have as being adopted, didn't have parents that had that interest at all. It just, kind of came natural to me. Um, but I saw my only way of getting into the health field because of not really having a formally holistically trained person in my life at the time. I ended up kind of landing in allopathic medicine, pre-med, in early. I started college classes and when I was 16, and so was really on a pre-med track for uh, those beginning years, and kind of it went from there. A lot of different things along the way led me closer and closer to the holistic side of things. But I what even within allopathic medicine, I was still very interested in a much more natural approach within allopathic medicine being my primary interest, really, aside from, for a period of time, really being interested in the like emergency surgical procedures. I was really leaning more towards the sports medicine, biomechanics, kinesiology, and chiropractic, orthopedic, chiropractic side of things. And so those are actually, even though they're allopathic practices, those are things that are definitely much more incorporative of a natural frame of mind, at least. So that I've got a pretty varied background, and there has been, definitely different life experiences, my own and also my son's vaccine injury, that just led me closer and closer to a very purist approach. But yeah, that's a lot of small stories, within that summary, basically.
Yeah, so you started off pre-med and um, started leaning toward more holistic ways of healing and just becoming more fascinated with that, and ended up just going out on your own and getting certified in like a million different things. We were talking about it just before hitting record about all the different things you're certified in. So I think you were starting to make a list. So why don't you tell us just a general idea of some of those things that you are trained and certified in so that the listeners have an idea?
Yeah, I really was. You said it the right way. It was really almost like an obsession it was like this. Once I figured out that there were actually formal trainings within the field of natural medicine, it just became almost like an obsession to just learn about all of them. But, some of the things that I am specifically trained in is nutrition from, of course, the conventional standards. I ended up with a nutrition degree, and then integratively as well from Institute for Integrative Nutrition, and then really went completely to the other side of things, all the way over to a very primal lifestyle approach through diet, through prehistoric origins, and healing through an evolutionary perspective. So a very primal approach to diet as well, taking the work of anthropologists and basically changing my views to lean towards a very purist approach to nutrition. And then I am certified in cupping and moxibustion as well, detox protocols, specifically GAPS elimination, the autoimmune protocol, Gerson therapy, therapeutic ketosis, microbiotics. And then I also incorporate EFT tapping to address the spirit, emotional issues of things. And I do Thai yoga and scar therapy, myofascial release, including several different types, Graston and trigger therapy, acupressure, gua sha, manual manipulation and stretching. I'm also a reflexologist, and I do incorporate into most of my appointments just some type of light therapy, sound therapy, Reiki also just by nature. And then I do a lot of a lot of different types of electromagnetic therapy. And I use the Beamer mat, but then also use an electromagnetic device. And then, some things that I really kind of incorporate and spot treat in is still incorporating things like body talk and biomagnetic pairing therapy, touch for health, even things like Qigong practices, and a lot of meditation and mindfulness awareness practices, primal approaches like sun gazing and earthing. So I really, with everything together, I tend to have a mosh posh of things to pull from, and have always kind of been a mix and match and pull a little bit of this and a little bit of that. So, my natural medicine program did specifically include indigenous Thai traditional medicine, Native American natural medicine, Indian Ayurvedic theory, Indonesian Unani medicine. So there's a lot of, homeopathy classes. I'm not a homeopath, but certainly, had classes specific to of homeopathy and herbal, herbal classes, and kind of do a lot of what I guess most people refer to as CE courses, or just new classes. Whenever I get an interest, I'm now currently looking into really adding yoni steaming to my practice, just because of the kind of things that we're going through in current times. Really has led me to the conclusion that we really need to pay specific attention to womb healing. So I do also for not really officially, but just for a lot of people, I have ended up kind of falling into the position of a doula, and being able to utilize most of my other modalities within that arena as well. So I don't really put myself out there for the doula position, because it is very time consuming, and you really have to be dedicated to one or two people at a time. So, but I have done it a handful of times for close friends or patients that I know really well, that really are wanting me to do that for them. So
see what I'm saying? Like, she knows everything. So much stuff. And I think what makes you so special is that you have such a curious mind. So if you see or experience anything that you feel like, works or could help you or could help someone else, then you want to know about it. And I think you're kind of a genius because of all of the information you're able to retain for all of that. I have to give you major props on that because sometimes when we have conversations, you just throw out so much information at me. I'm like, I need a pad of paper and a pen, and we need to sit here for an hour so that I can actually take in all the information you're giving me. So it's just awesome.
Thank you. Thank you.
All right. So why don't you tell us a little bit about your story, your own personal story with cancer? I know a little bit about it, but it's fascinating. I want to know how it came about and how you ended up healing yourself. So tell us all about that, please.
Sure. Well, a few years back, I just kind of realized that I started having just a lot of different health concerns. Unlike how my health had been the majority of my life, I all of a sudden just found it really hard to conquer specific health crises I felt like I was in. I had Hashimoto's. I was having heart palpitations. I was having severe brain fog, Epstein-Barr virus. I knew that there was something more wrong and did a lot of diagnostics through even with allopathic medicine, pulling my own lab tests and things like that. And really went through even holistic healing centers or integrative, really more, because I saw the root cause as being from toxicity. One of the things that I really basically take everything back to the root cause being either toxic burden or deficiency of something natural that we should have more of. So I was like, coming from that perspective, I was like, okay, what am I not having? Or at least what am I not absorbing? And then what toxins do I need to get rid of? So I was doing heavy metal tests. I was ended up, doing chelation therapy, ozone therapy. I kind of put myself on a, Gerson, kind of a mixture of microbiotics, Gerson therapy, and then a paleo standard for therapeutic ketosis, and was doing the IV, all kinds of different IV therapies, chelation, and then also UVBI, peroxide therapy, high vitamin C, glutathione push, the whole nine, and was still just feeling like I wasn't getting to the root cause. And kind of as I described before, not, my story being very much of a journey rather than being closely affiliated with or having a mentor that was actually formally holistically trained. So a lot of self-discovery through my journey. And back then, I when I first had breast implants put in years ago, like it was about 8 years before I really started getting sick. I realized finally, after going through a lot of integrative therapies, that it was because of my breast implants that I, along with the other stuff, all of the other stuff, that I had also officially been diagnosed with cancer. Through thermography and an oncoblot test and working with a couple of integrative oncologists, I decided to pretty much reject allopathic approaches altogether, because for a very short time I did at least go and visit an oncologist and an OB, that both offices I was kicked out of because of, I guess, not being compliant with their biopsying requests and their mammogram requests and their MRI with with contrast dye. prescriptions, and denying all of that essentially prompted them to send letters essentially kicking me out of their practice. So I said, okay, I'm doing this on my own. And so I went, found a couple of integrative oncologists over in our area, Sarasota area. And I just said, I don't really need any help. I just kind of want to run some things by you guys. I already have a plan in mind. Can you help me? Or I'm doing this completely on my own. So they were agreeable to at least just, give me a couple of conversations, guiding my way, keeping me on track with the plans that I had in mind. And so basically it took me about 3 months to have a complete en bloc and capsulectomy. And basically that once they were removed, I knew before, I had seen an article, a friend sent me an article about breast implant illness. And I kind of just knew in my gut that that's what it was. And so it took me about 3 months to plan the surgery and get on the schedule with a surgeon. And as soon as they came out, basically, I started kind of chipping away at, or as many holistic practitioners like to refer to, peeling the layers of the onion, which can get super annoying at times to hear that over and over again, but it really is a great explanation for the way that things happen in the body. And so I've just been peeling away at it. And I do think, there was a lot of things that contributed to that, probably besides the breast implants, that certainly was a main contributing factor. But I do also believe in the Louise Hay, like emotional attachment to things, and having past trauma with mom issues, and possibly being an over nurturing person, but not putting enough time aside for self-care. Those things certainly, I believe, played into me being more susceptible to the breast implants being even higher risk for me, outside of maybe a person that did not have the nurturing emotional connection to having mom issues. Obviously, I said before, I was adopted, so yeah, there's always a lot of emotional trauma attached to physical manifestations. So everything's cumulative and compounding, I do agree, but certainly I definitely know that that the breast implants were a huge part of, and I mean, the cancer cells were actually attached to the capsule. So, and I did end up having those integrative oncologists come back and say, thank God you did not have a mammogram, because where the cells were attached to that capsule on the back left side of your breast, like a mammogram essentially would have just squished it all together and probably ruptured it into, like, underneath my armpit, into my lymph nodes and everything. So over and over again, my convictions were validated. And so that there were a couple of things that I feel like were mistakes along the way that, looking back now, I may not have done. But that is, definitely has been incorporated into a main part of my practice, is really being there for people with cancer situations, and helping to facilitate a mindset of knowing, like, how powerful their own body is, to kind of come back to a point of homeostasis, and a point of what, really wanting to be well. And as long as they can visualize that, get an action plan together, people should, be very confident in the fact that our body naturally desires to be well.
Right. Oh, that one hit my heart hard, because it's so true. It's a mindset. And I think it's podcast episode 3 that I recorded, where I started talking about how believing that you can do it, and believing that it's possible for you, to heal your body, for your body to heal itself, basically, and you to provide the environment for that, to help assist in providing the environment for that to happen, is key. Because you can hear people like England and whoever else, myself, talk about how you can heal your body, but if you've just gotten a diagnosis and you don't know where to start, and we're so conditioned to listening to and going directly to Western medicine, right? It doesn't seem like there's a way. All you're going to get with them is pharmaceuticals and, radiation treatments or whatever. They're going to just pumping all kinds of stuff into your body as a way to try to fix it when your body wants to fix itself. But when you don't have the experience or like the faith, you can want to believe that there's natural ways to heal your body, but without the having done it or going through the experience of learning to peel back that onion and learning that it really is possible for you too. It's not just, something that sounds good. That makes all the difference. That makes all the difference. Knowing that it's possible for you, believing that it's possible for you and that you can do it and that it's available out there. And my wish and my hope and my prayer is for this planet to move more toward, and I think it is, more toward these natural ways for healing your body. I mean, that's the point of this podcast, is to awaken the world and knowing that there are ways and things you can do on your own, through the help of knowledgeable people to heal. And you do not need to rely on Western medicine, which is basically just run all based on pharmaceuticals, the money behind the pharmaceuticals, which are killing you. At the end of the day, they are killing you. And so there's my little rant on that, but it's mindset.
No, it's so true. It's so true. I mean, we're so conditioned to believe that things should be a quick fix as well. And so, we have to kind of come to a place of also realizing that it doesn't take us 10, 20, 30 years to become or to be in the state of dis-ease that we are, and then us expect to naturally overcome it in sometimes even a year. But a lot of people really that are new to holistic health, that's the major thing to overcome, is that thought process that they can get over even just a simple illness or something within 2 or 3 days. And sometimes, we just have to realize and become more intuitive with our body and realize to, have gratitude in small amounts of progress at a time, and just know that it's going to take a little bit to reverse conditions that have taken you so long to actually acquire. I've never really, that word must have come out wrong. I'm like, acquire, the acquisition of a disease, but really that's, kind of, how it happens over time, because it's so much different, so many different cumulative and compounding factors that have led to that fact. And there's, things that don't really even surface until you clear some other things out first. It takes more time. I mean, that's the one thing that I can say about a holistic lifestyle approach, is that it does take more commitment to consistency and duration. Like it takes tenacity. It takes, the consistency of being very routine, and even in just even minor, illness protocols and things, getting over a cold or sinus infection or whatever, the frequency of which you have to do things are sometimes even a lot more. So
Gosh, this is hitting home for me so big right now. And I want to tell a little story that England knows, how the lesson here was just be patient and take the time, which I should know that. I mean, I'm going on 2 years of, being in kidney failure. but still healing gradually every day. But I chose not to go the easy route and get that kidney transplant. I could have done that and be living, perfectly fine for a while, because eventually I would need another one. But I would also be on heavy medications for the rest of my life. And I didn't want that, right? I didn't want that. So I chose the long haul to heal my body on my own. And I'm so glad that I did. It was worth every single second. So, but this other little story I want to tell you, and I'm going to try to make it really fast because it can be lengthy, is, so if you listen to last week's podcast, you know that I just am recovering from COVID. And when I had COVID, I threw up a lot. And I don't know what that was all about, but for whatever reason, I was throwing up a lot. I couldn't keep anything down, nor did I have an appetite. And so I was prescribed by a Western medicine doctor, Zofran, which helped me tremendously. It helped me actually eat food. But one thing it does is make you very constipated. And so for weeks, I was very constipated. I was going to England, like, what do I do? How can I do this? And I got very impatient with it. And I started getting afraid because nothing was happening. And I was doing these natural protocols, some of which I couldn't do because of risk on my kidneys. But I was getting afraid that, something bad was going to happen. And I just started letting that fear creep in. And so I went to my kidney doctor and I finally resorted to asking what I could do, Western medicine wise. And she gave me this, first of all, she recommended Miralax, which is absolutely terrible for you. So I said, hell no, I'm not doing that. What else do you got? And she recommended lactulose, which I didn't know too much about. So I started taking lactulose for about 30 hours straight. I was taking it every 4 or 5 hours. And lo and behold, about 1 a.m. one night, I all of a sudden start coming down with this 103.5 temperature. I started throwing up, which was hard to throw up because it was like sludge because the lactulose was pulling all the liquid from my body into my stomach. By the way, I had not had a bowel movement at this point still. And I was just very gassy. And I'm just like, what is happening? And I started getting vertigo and ringing in my ears. And it was like, my body was just felt like it was shutting down and I was freaking out. I was like, do I have sepsis? And so I had no idea what was going on. I was like, maybe this is my kidney is failing. Like, what is happening? And so I freaked out. And of course, out of fear, went back to the hospital. What did they do to me in the hospital? They gave me more Zofran and morphine because I actually had a fractured rib at the time from coughing and it was really painful. And I should have known better not to take it, even though at the time it sounded like a really great idea. 2 things that will make you even more constipated, but not really in my right mind. I let them give them to me. And then they were like, maybe you have a blood clot. And so then I got radiation from a CT scan. And then they wanted to do a nuclear scan. And I was like, what? And put radioactive contrast in my lungs. I was like, I said, no, you're not doing that. I should have said no to all of it. And so then they let me go and they're like, all the tests show you're fine, you're fine, you're fine. So I leave and no one addressed my constipation. And basically I blame the lactulose for putting my body into some crazy shock mode. Okay. So lesson is at the end of the day, all of this happened because of the medicine that I was taking, the Zofran, which I didn't even know that was why I was constipated until I got out of the hospital that day. But I was just like, what? And they gave me morphine and more Zofran. So what are they even doing? What are they even thinking? What was the whole point of this? I just got pumped with medicine and radiation for no reason. Of course, I didn't have a blood clot. I didn't have any signs of a blood clot. They just have to rule everything out. So I get really fired up about this topic because it all comes back to, I should have just waited, and lesson learned, I'm not beating myself up, but going forward, now I know when I just kept taking my natural supplements for the constipation and just let my body ride itself out, I eventually had a wonderful few bowel movements and everything was good. And all I told myself was just be patient and go with it and let it happen on its own. And of course it did. So I learned so much from that experience, but that just is exactly what England's talking about. Like, it takes time, but it's the way to go. It is the best thing for your body.
Right. It's like not letting yourself get caught in that downward spiraling, cycle of really what, allopathic medicine is from a preventative perspective. That's not what it's really there for. Let's, give credit where it's due, and for life-saving procedures and truly, life or death situations. And limb loss, and being able to, a lot of the diagnostics even are what cause the problem. So, things that are truly life-saving procedures, of course, like we want to have, gratitude that we have that advanced surgical technology and allopathic medicine, there. But, by nature, and allopathic medicine from a preventative approach really doesn't exist. It's a sick care system. It's not a health care system. It truly is, a sick care system. And it's also band-aid approaches for things, and they're not getting to the root cause of anything. So that's definitely a perfect example of a personal story that I've just heard so many similar to that, where people have kind of just gotten burned by Western medicine. And it's not that nurses and doctors don't, have great intentions going into it. I mean, I know I did, and I really wanted to save people's lives. And, that was one of the reasons why, life-saving surgical procedures was one of my first interests. But the way that they are trained, we have to remember, was, bought out long ago by the Rockefellers. And those medical systems and research and everything are basically based on and funded by a bought out system. And so they teach one perspective, and one perspective only. And what we have to realize is that that hasn't been around for very long. And some of the modalities that I practice, for example, have been around for more than 2,500 years. They were what we used as primal humans to become the most dominant and the largest brain of all of the species.
Yeah.
So, in comparison, when it's actually very abnormal in modern times that people's first thought and natural compelling, like, force of like what they think of, the doctor in the white coat, is actually the newest. It's the newest, and they refer to it as alternative, when really allopathic medicine should be referred to as alternative medicine, because it's the newest. Ours is traditional, holistic ways and cultural specific ways, and evolutionary perspectives are all so much more traditional, and were literally used for thousands and thousands of years before allopathic medicine came along. And then allopathic medicine was essentially monetized from, in such a way that, even back in those days, like, herbology and natural medicine really started being scrutinized and banned, and, people losing their license because of using herbs for medicine. So we kind of have to recognize too, just from a factual historical perspective, how much I guess corruption, I guess, is the best way to really put it, how much corruption and it started with. And then essentially they basically looked at the cheapest way to create medicines, which was with petroleum based, fossil fuels. And of course, that's carcinogenic. So there's not a pharmaceutical medication out there that doesn't start with, carcinogenic chemicals in order to produce it. And it can't be natural because they can't patent that. That's not good for business. So that doesn't make them any money, you know. It's like a perfect example is I think it's called Tamiflu, which is a, medication used in allopathic medicine that essentially the active ingredient, the effective and active ingredient is star anise. And then they add a whole bunch of other junk into it to be able to patent it and make money off of it when, you can just boil some star anise in some water and drink the tea. Or, you can make tinctures with it. You can, do all kinds of, different applications with it. But, it's just it's disappointing when you go back and see the history. And I think some people, this whole cognitive dissonance comes into play, and it's like when they've been trained in this area and they've had really true intentions to help others, um and then they've paid a whole lot to go to these schools too. So it's like kind of next level brainwashing, because it's the expensive paid for type of brainwashing, indoctrination. And it's almost like they would have to go through a complete identity crisis to untangle themselves from those belief systems.
Oh, you said that so well. It's so true. Yes. And she's referring to like Western medicine doctors and medical workers is what she's talking about. Just the identity crisis they would have to go through if they were to, like she said, untangle themselves from these belief systems that they were raised believing and trained to believe. And it's tough. And neither England nor I are here to criticize anyone in this medical field. Like, we know your intention. So it's not that at all. It's just more of like, we're awake to seeing what's actually going on because we've both had to do our own research. We were forced into these predicaments through our health situations, her having cancer, me going into kidney failure. I didn't know any of this stuff until I started really diving into how to heal my body. This was all brand new information to me, and it was mind blowing, right? So it's just, and I'm continuing to learn more and more every single day. And I know England is as well. So it's a whole new mindset shift, and really hard for a lot of people to take in because of the cognitive dissonance. And, and no one wants to hear it. We want to believe that, our medical system is great and here to help us. And in a lot of ways they are, but, not really, not
Yeah.
foundationally. So, and one other thing I want to talk about really quick before we go, because this is a really cool story and I only know part of it. I know, and I'll tell you what I know, and I'll let England fill in the blanks. So England is a proud mama of 3, and one of her children, her son, was had a vaccine injury at an early age. And I know that the doctors told her that he would never function like a normal human to some degree. And so England, if you can tell us a little bit about what he was diagnosed with, what they told you, and where he is today.
Yes, it's that's a very really tragic, but then also really promising story. And knock on wood, we still have a ways to go, but essentially, just from my very natural tendency to lean more on the conservative side of any kind of conventional approaches, I actually chose not to vaccinate my first 2 children until about 12 to 14 months old. So at the time I was in integrative studies. So I knew, and I was very nervous about and questioned vaccines in general, but I certainly was by no means like anywhere I am today from the very purist and holistic side of things. So at the time, the best resource that I really had was Dr. Sears, his book, and Senior. And so the only one that I had felt necessary for them to have, I gave at about 12 or 14 months for both of my older two, which were very close together, about 17, 18 months apart. And so at 3 years old, my son had only had that one previous vaccine. And I was taking him to a new pediatrician that I had no idea back then that there was really anything wrong with not vaccinating, but I also did not know much about advocacy, the type of advocacy work that I do now. So I didn't really truly understand what informed consent was. Um, anyway, basically got really bullied, arm got twisted into the first time visit at this new pediatrician's office. And essentially, as a young mom, recently separated and divorced, raising two kids on my own. And, just really not having an easy time at life at that point. I was going back to school full time to finish up my integrative studies. And this new doctor basically said, oh, you need to catch him up today on 8 different vaccines. And I just, was able to somehow maneuver my way out of all of those and only agree to, um, you know, through, I guess, coercion and being threatened and being told that, social services would be called, and the whole, bullying approach. I ended up giving him the MMR that day. And that, of course, being, 3 shots combined into the one. And he had an immediate reaction, immediate brain swelling, encephalopathy, going into a seizure within a couple of minutes after the shots. And I just knew from that point on, there was just something that kicked in that said, never again. Like, I'm not gonna let this happen. And it just kind of dove me into like a whole nother level of research. And I knew in my gut, like he was way above schedule, above the charts and everything, physically and psychologically. He was and totally digressed. Basically, he went, completely nonverbal. And it wasn't until about 7 years old that he was officially diagnosed with autism, with some smaller, diagnoses within that label: OCD, oppositional defiance disorder, sensory processing disorder, auditory processing disorder. Um, it was just, and then, there was obviously some major, speech regression. And essentially, we ended up getting his words to come back around 7 or 8 years old. And, before it happened at 3 years old, he was, like I said, just completely flying above any of what those charts mean. Not to necessarily put any weight on those charts. They're all fraudulently created anyway by formula companies, and really don't have anything to do with true health and progress and appropriate development for a child. But at the time, I still didn't realize that, and just knew that, he was performing well above average on all of those things. And, he got to the point where, completely stopped nursing. He, never nursed again after that day. He couldn't pick his head up at times. It was almost like he didn't have the strength like in his neck to even hold his own head up. He would drop his head down into tables and bang his head into walls. we had to do the whole helmet, padded helmet thing for a while, and he'd drop his head. He would, I think because of like the dizziness and vertigo types of effects, I mean, which encephalopathy really kind of causes those like, brain like feeling like a balloon up in the air kind of feeling. So you would kind of see him walk, and he would be walking sideways and straight into the wall, let his head drop down to the baseboards, and then just start running his head against the baseboards of the room, and going around the room, and total blank stare, behind his eyes, like there was just no, like, I don't know, like the spirit just wasn't even there anymore. The consciousness just wasn't there anymore. It was just the empty shell of, of who he used to be, the very engaging and very like expressive and curious child, an active child. And basically, I was told that, I mean, his prognosis was very dismal. I mean, they said that, he would have to be in home care, taken care of by us for the rest of his life, and that he may have the IQ of maybe 75 someday and be able to do a very methodical job, like a manufacturing line somewhere, very much like the movie Rain Man type of situation, like things repetitive in nature over and over could be learned through memorization. But as far as actually having any major, capacity of frontal lobe abilities, they pretty much told me that was out of, that was just not even a possibility. Lots of journey along the way with that, but just to try to, summarize and come to a more positive side of the story through primal lifestyle approaches, and really bringing the occupational therapy into the everyday life within our home, rather than being overstimulated by constant appointments all the time. We ended up using only holistic approaches. A lot of the treatments, I did myself, but we did also see, a craniosacral therapist, and a lot of chiropractics, a lot of natural detoxing approaches, homeschooling, grounding, a very primal connection approach to getting him grounded every day, and a lot of really just, like you said before, being patient. But at about 9 years old, he was IQ tested. And we had made some progress at that point, because there was at 7 years old when we finally decided to get the kind of true diagnostics done, not because we really cared about the label, but just to kind of have like a direction in mind of what way, because I don't typically like being labeled or labeling people with this or that, because I do feel like it's almost debilitating. And if they're told and they hear something, if people, hear something over and over again, about what their loss is, or what they're not capable of, then they tend to believe that, right? And so, I never told him of his diagnosis. I never mentioned his prognosis, still haven't mentioned that to him even today. So unless he later on ends up being curious enough about mom's, interviews and, advocacy work and stuff, he'll probably, never hear that story. But he was tested around 9 years old, and, tested literally like 146 IQ, mental level IQ. Like, it's just, like what I can say about like the difference between situations like mine and many, many other patients that I work with to help heal vaccine injured children, and even adults, is don't believe the prognosis. If you don't believe the prognosis, then it's not going to manifest, and there's a huge difference between the parents who just become complacent with where their child is at, and give in to the allopathic approaches, and just, kind of just believe that this is the best it's ever going to get. And those kids, you don't see the drastic, reversals in. But with the ones that never give up on their children, and they never give up on finding a new modality to try. I mean, you have to be consistent, yes, and you have to give things a chance, yes. And so that does take time, but that's the great thing about natural medicine, is that it existed so many thousands of years before, we were even here, that there's limitless options, that no matter how much of an expert you are in holistic health, there's always going to be something new to you, but very old, that you've never even heard of. So you just have to keep trying. And, I know it's taxing on the budget. So yeah, you got to budget things out, or you got to make sure that the splicing the timing with the right modality too is a very important part. So just because you've done something in the past, a couple of years ago, doesn't mean that it may not work again in the future. But when you first tried it, maybe it wasn't the right timing. Like you needed some other things first. So that's why it's always good too, to find somebody who knows your whole story, or your child's whole story. And you can always go back to them and say, okay, we've done all of these things, because it does become very frustrating to tell your story to so many people, and to not just have at least one person that knows everything that you've done, that you've gone through, everything you've tried. And so if you can find that one person that you resonate with, even if they don't practice all of it and they have to refer you out to things that they don't do, that's still fine. They know you did it. They know where you're at with it. They know your compliance level. They know your child's compliance level, more importantly, if that's the situation. But I can just say from my own personal experience with my son, unless you are a developmental child specialist and you have some more ongoing interaction with him in a multitude of different situations, you probably just in passing from the outside looking in would not even realize that he has autism. I'm not sure if you've met my son, Sydney, but I think you may have seen him a couple times playing basketball outside and everything, but he is, like I said, I would say 80% cured from autism.
Okay, so first of all, I just want to sit here and point out what an amazing mother you are, because not many mothers would go to the lengths that you have gone to help their child. And unfortunately, a lot of people just resort to medication or, something to just help them cope with their situation and cope with the world as it is, and not take the time and the energy to really pour into helping them, when you are proof that taking those steps will heal them, and to never take a diagnosis as concrete ever, no matter what. And then really start and think about how you even got there. Was, so many times it is a vaccine injury in children, and that's just, no one talks about that, which is incredibly frustrating. Those vaccines have garbage in them, and they go straight through the blood-brain barrier. And anyway, that's a whole nother podcast, which I will definitely have. But yeah, England, major props to you for being such a good mom, and then just being able to help so many others as well with your skills and your knowledge is just so refreshing. And what you were saying also about finding the one person that can help, that's what England does. She's the one person go-to. She doesn't claim to have all the answers, but she is so good at pointing you in the right direction if she is not the one to help in some specific area, right? So I want to tell people how they can get in touch with you. Of course, I will put everything that she says in the show notes, but how can people reach out to you, England, if they want to schedule some time to talk to you or whatnot?
Thanks, Sydney. Really, I actually kind of go in alignment with my practice. I'm pretty old school about things. And if you need me to call you back, then you can definitely text me that. But essentially, I do no online booking or any kind of complex, digital strategies for booking myself or advertising or anything like that. I really only work within personal recommendations, typically personal referrals, and then just by text, 334-559-0176 for now. And that's an Alabama number, by the way, that I've just never changed. So I may change that sometime soon, but basically just, text for an appointment. We go back and forth a couple of times, see what timing and days work. And then if I need to schedule a 15-minute, phone consult just to have a little bit better idea of the focus that we need to have in an appointment, then we can do that as well. And then, a lot of times I do see, multiple people in the family at the same time. And the way that works, is definitely just basically spending the amount of time that we have on every person. So it may be a little bit less relaxing and more hectic of an appointment, but at least we're addressing all people at the same time. As you well know, a lot of times when something happens to one person in the family, it kind of goes through the whole family. So it kind of becomes taxing and ridiculous to have to go to a different person for each person in the family. So, or a different doctor for each person in the family. So I try to really help expedite the whole process with things like that. And I don't charge any differently for however many people I see in the family. I just, ask for the understanding that obviously the time that we have will be spread across everyone versus if you came in by yourself and had the time to really focus and spend more of that time in a more relaxed atmosphere with some more specific modalities rather than handling an acute situation for, a few people in the family at the same time. So definitely some, little bit different types of feelings and environment in different types of appointments.
Yes, and I can attest, when my family got COVID, both my husband, my mom, myself, and my dog all went, and my son all went and saw England, and she did some magnetic pairing therapy on us, and it's the whole things and a bunch of other stuff too. But anyway, so England is in Safety Harbor, Florida. And do you see anyone remotely, or is everything that you do just in person?
Oh no, I do actually. A lot of times I will do home visits, especially for my pre and post surgical patients. Just because of doing scar therapy and detoxification after required surgical procedures and stuff, I will do home visits for that reason. And also in cases of young children or just anybody being sick enough to really not need to get out of bed and leave their home. So I do home appointments. And then I also do any type of, Zoom or video call or just phone calls sometimes when it's people who aren't local, but just need to work from, maybe a more of a coaching lifestyle, primal perspective coaching type of situation or a protocol or diet protocol or, things like that don't have to have hands-on. Then I do a lot of those phone appointments as well.
Awesome. Okay. So I'm just going to tell anyone listening, especially if you're local, but even if you're not, if you have any kind of issue, if you just have a stomach ache, if you have recurring headaches, if you have elbow pain, if you have literally anything going on in your body that you have questions about and you're curious about what you can take or do or whatever, you need to reach out to England. She is the starting point person and she's absolutely incredible. So I will put her phone number in the show notes. Just reach out and text her and tell her that you heard her on the podcast, if that's what she needs to do, and just make an appointment, because she is absolutely amazing. And I can't even tell you all the different new supplements that she's given me in the last few months that I've been taking, and, just not just supplements, but, recommendations on treatments, like treatments for my kidneys, as far as like, what's it called?
The electromagnetic therapy.
Well, no, we've got that, but I'm thinking of the oil, the castor oil with the essential oils, putting those packs on my kidneys, drinking different teas, drinking watermelon and cucumber juice every morning, just different things I have changed in my diet to help my kidneys, and they're doing well. So it has only been a short amount of time. So I can just attest to her amazingness. She's very thorough. She's very knowledgeable, and you need to reach out to her. So anything else you'd like to add, England?
Oh, just that you're the amazing one, and compliance and consistency is everything. So, what I suggest only works if somebody's actually following through. So really the success and the progress is primarily because of you.
That's true. We're all responsible for our own bodies, and no one else is going to come save us from our situations. I think that's a really big deal. We're so conditioned to looking to outside sources to save us, to help us, and we have to take matters into our own hands. And that can feel really overwhelming and overbearing at first, like, oh my God, where do I even start? Right. And but just baby steps. It's all about baby steps and trusting your intuition to guide you where you need to go to get the information that you need. Because remember, your body talks to you. Your body knows what it needs, and it is in communication with your intuition as long as you are paying attention, as long as you're tapping in, meditate, like get close to yourself, get just a really good foundation in knowing how to hear yourself and listen to your body, because it knows what it needs. And always listen to your body over your head. If your head thinks something is good and your body doesn't seem to quite agree, always go with your body. Would you agree with that, England?
Yeah, there's such complex reasoning behind it. Like we talk about these cumulative and compounding types of factors that we can't sometimes understand in our brains, why something is just not good with our bodies. But, I try to teach at the very beginning of things. I try to get people like really grounded in knowing themselves well enough, and at least at a very basic level, being able to muscle test themselves and know and test from one day to the next if this supplement or if this food is serving and is in my best interest today. Does this, serve my body well today? And be practicing with that, every day, so that you can use that intuitive, kinesiology in order to make sure that you're listening to your body first.
Right. So important. All right. So we've been on here forever. I think it's time to wrap up, but thank you again, England, for coming on here today. And I hope that you guys took away so much from this intense conversation. And it was a pleasure being with you here today, England. And I will catch you guys in the next episode.
Thanks, Sydney.
Thank you so much for tuning in to this episode of My Inner Tiger. Before you go, I have a free gift to offer you. If you're anything like me and struggle with overwhelming feelings of stress and anxiety on a regular basis, I invite you to download my Freedom in 5 formula, where you'll discover how to change your state in less than 5 minutes. This is my beautiful gift to you and costs $0. So head on over to myinnertiger.com/freedom to download this now. Also, if you loved what you heard today, please rate and review this podcast on iTunes so I can keep the ball rolling. And finally, if you're not already, come follow me on Instagram at myinnertiger for more juicy goodness and fun inspiration. I can't wait to connect with you there. Now, my dear friend, go out into this world and create some magic. I'll catch you in the next